Notes are always displayed in chronological order. I can always scroll down and see all the notes from the past to get a better history of this particular client. And to add a new note is quite simple. I just simply click the New Note button. Then I'm presented with a new note form. And there's three different types of notes that you can add. You can add a simple note, like the one we see here. The first two fields just verify the date and the time that this note will be entered. And if I like, I can enter the duration in minutes of the session that this client was recently in. And then finally, for the simple note, I'm provided with this text box where I can put in any note that I like. It could be anything just relating to the client in general. Wouldn't necessarily have to be a therapy note. And then finally, at the bottom, all notes do allow you to enter a digital signature. You'll just simply check this box, and based on who you're logged in as, you'll see your name appear down here at the bottom, and you go ahead and check that box to digitally sign this note. And just be aware that when you do digitally sign a note, you cannot edit it after the fact. So it kind of locks that note in place to make sure that the information is not edited or manipulated after the fact. So if a simple note format is not what I'm looking for, I can then move on and select the progress note format. You can see the form quickly changes for me. I still have these same fields at the top where I can verify the date and time of this note being entered. But TherapyZen now provides you with some different tools that you can use at your disposal for this progress note. And one of the first things you can do is your risk assessment. If the client is not exhibiting any suicide or homicidal risk, you can just click your None Presented boxes here and then move down to Interventions. For this particular example, we'll just go ahead and select DBT. And then as we move further down the form, we can assess the mental status of the client. I can go into these mental status selectors individually. However, if everything seems to be within normal limits, I can just simply check this box, and those will get pre-populated for you. After we pre-populate them, you still can come over and override one if you wanted to. And then finally, down towards the bottom, we have our text box for the actual progress note. I'll go ahead and put a progress note in there now. Okay, and once I've got a progress note in, I can then make a recommendation on this particular client. By default, we go ahead and check to continue current counseling focus. You can select to alter counseling goals or objectives, or finally discontinue or terminate this treatment. And then lastly, once again, I can go ahead and choose to sign this particular note if I'm happy with it and I'm ready to go ahead and close it out. But for this example, I am going to just